Hi there. I'll be talking today about cosmetics treatments for the face. All different cosmetic treatments, just everything in brief. And when we talk of cosmetic treatments for the face, we should probably look at the face as made up of several layers and going from the hair all the way down to the bone. So the first layer that we should consider is the hair themselves, which are the appendages of the skin. They come out of the skin and you can treat them in different ways. There are many hair treatments, cosmetic treatments, non-surgical treatments, surgical treatments, from creams and lotions to getting your hair trimmed to having more aggressive treatments. So the first layer is the hair themselves. You can have long or short hair, excessive hair where you don't want them, and lack of hair where you would prefer to have them. So we can get treatments for all of those, including hair transplantation, laser hair removal, and so on. The next treatment that we think of in terms of different layers of the skin, the next layer would be the surface of the skin itself. And that would include the first few layers of the epidermis or the superficial layers of the skin. That can be improved by applying topical ointments and gentle vitamins, low-grade chemical peels. And there are many other cosmetic treatments that are available over the counter. You can have facials done, you can have hydrofacial done, you can have cryofacial done, a bunch of facials that would improve the superficial layers of the skin. These superficial treatments rarely go beyond the epidermis, the top layer of the skin. The deeper layer of the skin, you can have other treatments done, and that would be our next layer. The third layer would be the deep layers of the skin. And that is basically the dermis, which has the collagen, the tough layer, which has collagen, something that gives you more shape and more suppleness to the skin, besides the fat itself. But the deeper layer is what gives you a lot of structure of the skin, and that is called the dermis. It has a bunch of different things, but very importantly, the thing that we treat is the collagen. We can increase the collagen, we can remodel the collagen and make the dermis look better. We can sometimes even put some fillers in the dermis, although most of the fillers are put beneath it and just beneath the skin layer. But some fillers can be dermal fillers, which can go in the dermis itself. And that is the deeper layer of the skin. Now, the other thing that we can do with the dermis is we can do radiofrequency, we can do ultrasonic treatments, we can do some other treatments with microneedling, and we can do some lasers which would penetrate deeper. And all those treatments would give rise to a better quality of collagen. The type of collagen may change, and the amount of collagen itself can increase. So you can have better looking skin, which will be more durable to all the changes in weather and age, and which would look younger, because in youth the layer of dermis is slightly thicker, and these treatments are aimed to give you a more younger looking skin and a more defined skin. So that would be one way of improving the appearance. So first we do the surface, the appendages, the surface, then the superficial layer, and now the deep layer of skin. The next layer that we look at just beneath the skin is a layer of fat, and there are multiple fat pockets in the face, multiple fat pockets here, everywhere. There are multiple fat pockets, and those little fat pockets are slightly separated, but they are held together with little attachments. And these fat pockets, like there's one here, these fat pockets give suppleness and definition to the skin, to the face itself. So very often these fat pockets are treated, and there are various ways of treating these fat pockets. Usually the fat gets reduced with age, so you may want to put some fat or fillers to fill in the dents and the depressions. Those can be done depending on what fillers one wants, or if someone wants fat, that can also be done depending on what region it is. In this region we put very thin fillers and very thin nano fat. In this region we put something more thicker, something that would last longer, and those fillers of fat would give a more youthful appearance, and you can restructure the face a little bit, make it more youthful, and even change the shape a bit. You can give more of a chin projection, better looking cheeks, and improved nasolabial folds, or these folds that are there with the smile lines. Now that is for the fat beneath the skin. So there are fillers and there are other ways of improving the deep layers of the fat. And some of the things that are done deeper than the fat but affect the fat pockets. For example, if you do a little lift here, the fat pocket is what's actually being lifted up, although it is done deeper than the fat layer, and then it is tucked up so that the look is smaller, is more smooth. And what happens is that this depression between the fat pockets, that kind of becomes much less, and you have a younger, more youthful looking face. Other things can be done with the fat as well. There are some ways of making the fat less. Some people want the fat to be reduced, and a very gentle liposuction here can help. But what can also help is something called radiofrequency and invasive radiofrequency, or Ulthera, which is a kind of hifu based on ultrasound. So that treatment also will reduce the fat and tighten the skin. So it affects both the deeper layer of the skin, tightening it, and it can reduce the fat where one wants to. But one has to be very careful in reducing the fat. Most often it is better to increase the fat and fill it up rather than decrease it. When you do decrease the fat, one has to be careful that the skin has to be tightened, which can be done very well with something like thermi or face tight or even Ulthera. But one has to be again careful with these treatments not to overdo the fat removal or fat reduction. Then after the fat, we have the layer just above the muscle. The layer of the muscles is called the SMAS layer, and that is the layer that is often lifted in somewhat deeper facelifts, where you lift the face, the SMAS layer up, and the muscles come with it, as do the fat pockets. So you can have, not without overdoing it, you can have a nice lifted look to the face. Let it go up. We do it like this at the SMAS layer. So the SMAS layer is basically a little sheet of tissue. It's a little firm tissue which is just above the muscles. So it can be lifted up. The muscles will not hold sutures. No, they don't hold stitches. So the muscle layer cannot be lifted up by itself. But the covering of the muscles can be. And with that come the fat pockets as well, which can be replaced in the proper with their proper place. So this fat pocket can be lifted up with the SMAS layer, and that would decrease the nasolabial folds as well. That is the SMAS layer. After the SMAS layer, we have the muscles. Now the way to change the muscles or their action can only be done, or can mostly be done, by neuromodulators, which are basically things like botulinum toxin and other toxins which would decrease the nerve activity in the muscles. So these worry lines and crow's feet and even these bunny lines, they can all be reduced by putting a little bit of botulinum toxin, so that the wrinkles that form because of action of the muscles, those become less. So when someone is doing this will become less angry. When someone is doing this, there will be less of these crow's feet or less bunny lines and so on. So that is the muscle layer. Beneath the muscle layer, we have the cartilage supports, and then the bony supports to the face. And those can be changed or augmented or reduced with the help of either implants or surgery on the bone. So things like overbite, overjet, the jaws being too far ahead or too far behind, those can be changed. The chin can be pushed out or pushed in at the bony level, or there can be an implant put here. Similarly, there can be an implant put in the cheek or on the jawline, and those will remodel the bony support itself. So what you'll have is a more aesthetically pleasing face with better lines, softer lines for ladies and more angular lines for males. So the jaw has to be more prominent in a male usually, and softer in a lady. So when we are thinking of feminization or masculinization of the face also, the bones are important. A lot of what looks like bony changes can also be done with fillers and fat and so on. So there are multiple ways of treating the contour deformities, but the deepest level that we do it on is the bones themselves. So one has to think again of the face in different layers, and based on the different layers, one can do different treatments. I'm going to speak about different treatments shortly, but the main thing to understand is when you go to your beauty salon or to your day spa, They are doing a superficial treatment, which are wonderful. They feel great. You can have hydrofacial, which cleans things up thoroughly with jets of water. You can have organic facials. We'll have a whole bunch of papayas or mangoes or different kinds of fruit peels can be done, and some of them have beneficial effects in penetrating a little bit of the skin, and some of them gently peel away the dead layers of the skin. You can have very superficial peels which are incorporated in some of your creams, and those would also gently clean up the superficial layer of skin. I often advise people, especially younger people, but people of all ages, to use a little lemon or lime in water to clean their face, and that would often take care of a little bit of the superficial oils that are there on the skin, and can also act as a gentle peel. So that's a very home remedy or something that everyone can do every day, and it doesn't harm. So a little bit of lime, great thing to do, and keeps your skin looking good for a very long time. The other thing I often advise people to use is things like niacinamide or retinol, or vitamin C, and there are a bunch of others, but those things are good for helping the skin becoming more even in tone, and also in quick turnover of the cells of the skin. So the superficial treatments and like the spa treatments are fine, they help a lot, but they do not go very deep. So if you say, well, I'll have 10 facials, will that be like a facelift? Absolutely not. Will that be like a chemical peel? A little bit, not you know, they do very gentle peeling with fruits and so on, and that will help, but it's not like a proper deep chemical peel. The next thing that you can do that is done is giving topical creams, and that you have to be careful that they should be over the counter, where the strength is low. They're effective but safe, so the efficacy and safety ratio has to be maintained, and in that situation you use gentle creams. If you want to use something which will bleach your skin, use very low strength of those creams. So if you have to use hydroquinone, use 2%, don't use 4%. And also give it a break. Don't keep using the bleaching creams and then the depigmenting creams for a very long period of time. Sunscreen should always be used. As I said, there are multiple vitamins, multiple things that you can use to gently do some anti-aging treatments yourself at home. Some night creams. In the day, you can use some different creams as well as sunscreen. Minimize the exposure to sun anyway. So that is in terms of what can be done by yourself, what can be done by your esthetician in this makeup shop or whatever. You can use makeup to look better when you go meet someone. You know, there are some shadows where you can do some highlighting of the highlights and contouring of the contours with the help of makeup, and make your skin look more even. But when you want to do some more serious treatments, you should take the help of a dermatologist and then your plastic surgeon, or both of them, depending on what you actually need. So let's then talk of the next layer, which is the superficial layer of skin, but a little more aggressive treatment. Those would be chemical peels, lasers, or dermabrasion, or radiofrequency treatments to your skin, to the top layers of the skin. So let's first do superficial treatment, superficial peels, which are glycolic alpha and beta hydroxy acids. They are very common, it's glycolic or kojic acids. Somewhat deeper peels can be done, which is like TCA peel. Sometimes phenol peels can also be done depending on the tone of the skin. But the deeper peels should always be done after you've done a few superficial peels and prepared your skin with certain ointments and local treatments. So once this, otherwise there is a chance of post-inflammatory hyperpigmentation or depigmentation. So be careful with the peels as well. Then the next treatment is lasers, and lasers can be ablative or non-ablative. There can be lasers for removing the pigment in the skin, and there can be lasers which will help with vascular deformities. So multiple lasers, multiple blemishes can be taken care of with lasers, and those work fine as well. Then there is dermabrasion. Now there is microdermabrasion, will just remove the superficial layers of skin, and it's like a really good facial. But surgical dermabrasion would remove the top layers of the skin way down into the dermis, and one has to be careful not to go too down or to do it so aggressively that the pigmentation does not come back and you get a hypopigmented spot. So done carefully after skin preparation, dermabrasion is also a great treatment for many blemishes, scars, and so on. Now the next treatment for the scars would be fillers. Now you can do fillers and you can do lasers and you can deep lasers. You can do fillers and you can do fat, and you can do subcision, which lifts up the blemishes, the scars, and the fillers and other things would gently remodel the skin and fill it up where the indentations were. Next, we go on to radiofrequency and Ulthera and hifu, which all cause remodeling of the deep layers of the skin, and they can also remove some of the fat. So at the setting where they would increase the collagen, they do not give rise to loss of fat. So at that setting and targeting those areas, one should do the hifu or Ulthera, thermi or other invasive radiofrequencies like phase tight or J plasma. Those are done to increase the collagen in the skin by heating up and giving radiofrequency to the deep layers of the skin. Superficial radiofrequency also helps, not quite as much, and microneedling also is very helpful with radiofrequency. You can have PRP done, that is the platelet-rich plasma from your own blood that can be injected, and that would give you a lot of glow and a little bit of more life to your skin. So that is done. I often do it with antioxidants. Sometimes I use a little bit of stem cells from this fat itself, and without increasing in volume, it gives a very good result in terms of making your skin look more youthful and kind of just more alive. Then for the fillers and fat and so on, we have many different fillers available now. Most of them are like hyaluronic acid fillers, which are like Juvederm or Restylane, and they have different cross linkages which would make them last for different periods of time. So use them when needed. Go to a well-qualified dermatologist or plastic surgeon who can inject them for you and fill things out, give you a little lift just with fillers. Then we also have threads, and threads do not last for more than 1 year, although the claim is 1.5 years, but they do help if you want a quick improvement in your looks. Now, threads are also of multiple types, and your plastic surgeon or dermatologist would choose what kinds of threads would be the best for you and what you're looking for. The fat itself, as I said, can be used in very thin granules, very refined filtered fat to fill here, which is called nano fat, and then micro fat, which does not migrate as much and kind of stays put, and that can be put in different layers. You can have lifting of the skin with that as well. With the fillers, you have different points that it can be injected. Then there's some other fillers which are just to give your skin some more volume, just like PRP or very thin fat, and those will give you a little glow and the skin quality would improve. Then there are deeper fillers which would stay put and will give you more of a three-dimensional increase in the volume of the jawline or of the cheeks or chin. Then after the fillers, you have dermis. For the fatty layers, again, filling, as I said, and filling with fat or artificial fillers. There are some fillers which would, like Sculptra, which would increase the collagen or the quantity of fat by themselves. They don't fill up as much, but they give a kind of a framework for the body to build up its own tissues. Sometimes I do those things like Sculptra with fat, so that we have more fat and it has a kind of a lattice to attach itself to, so it gives a better three-dimensional look. Fillers and giving some kind of volume to the fat layer. The next layer we go to is the muscles, and there we can do botox. And just above the muscle we have that smaz layer we talked about, and that is improved by facelift, which lifts up all different elements from skin to the fat pockets to the smaz layer, as well as the muscles themselves, because they are attached to that smaz layer, so they themselves kind of go up. The facelift that we do now, some of them are very limited in extent, very small cuts, and that gives lots of improvements, like this here or like this here. Then we do some full facelifts at the deep layer, which give you an improvement for the entire look of the face. The deepest layer we do chin implants very often. That's one of the most frequent. Sometimes we cut the chin bone a little bit, protrude it forwards and fix it in its place so that it stays forward and gives a better defined look to the chin. Same thing can be done with the jaw. Sometimes we use botox for the jaw as well, just like we use it for the wrinkles here into the muscles, to give a more feminine or more defined look to the jaw here. Kind of gives you a longer face. Then with that we also do we also do some implants at the same time, and that would give you a more defined face here. So if we do, say, cheek implants, chin implant, and we decrease this, you'll have a more triangular looking face. But then all these things are to be added on and off as needed, and the amount of improvement you need is also very important to understand. So from top layers, from the skin down to the very bone, you can have changes in the bone structure, changes in the muscle, changes in the layer just above the muscle, changes in the fat pockets, changes in the fat itself, amount of fat. Then you can have changes in the above the fat itself. You can have changes in the different layers of the skin. The lines and the wrinkles can be improved, the quality of the skin can be improved, the scars can be improved, the blemishes can be improved. And then the last thing that, or the least thing that you can do is just camouflage. Do things so that you don't see them. So if a blemish, you can put concealers, and that is fine as well, but it is obviously not something that's going to last. It may last a day or so, but not more. So those are the things that can be done for cosmetic improvements on the face. And there are others that keep coming up, and there are others that I have left out, but these are the main things. And I think this should be sufficient for a while to keep everything in check, the aging, whatever the changes in bony structures, and whatever happens with age or with what God has given us. If there's something that you do not like too much, it can be changed. All right. Thanks for listening.